Welcome back to Profiles in Caring as we continue our story today on Joyce Clare and her efforts to bring health care to the rural community of Boerne, Texas. Here again, Doug Jardine.
Well, our base is here in Boerne, and we see patients every Wednesday evening, and we've been doing that for 5 years.
She started with a dream of quality health care and $500, and today, Joyce Clare sits inside her mobile health care clinic and next to a permanent home for providing quality health care to residents in and around Boerne, Texas. They help about 500 people on an ongoing basis, but there is so much more to do.
We estimate there's probably about another 1,800 patients in the community that could benefit from the services. Texas has the highest percent of uninsured people. 25% of the Texas population is uninsured. And a lot of those people are in the low-income category. They're working in jobs that, they can't afford insurance, or it's not available through their employer. And so we have a good many people that still need the service, and we want to be able to help them. So in order to do that, we'd like to be open more, and to do that, we need more volunteers, we need more financial support to do that. And we're making a big difference in their lives.
They've been very helpful for me. They've helped me quit smoking, which was really great. And they've helped me with my heart. I have an enlarged heart, and they've brought me under control.
Any of the clients were eager to talk about the value they receive, initially from the mobile clinic and now during their weekly visits to this permanent building. Letha had been smoking since she was very young.
I usually come usually like once a month, but since I quit smoking, they've been helping monitor me and making sure that my heart is doing okay with the change. Their encouragement, really. They helped me realize that if I really want to live, I need to quit, because having an enlarged heart lessens your lifespan as it is, and then me being overweight as well, and I don't want to die. Yeah, they gave me the gum. They got me on the patch as well, and I'm on the stage 3. So.
And I don't know what that means either.
Stage 3 is 7 milligrams, which is the least amount. So I'm on the last.
Making good progress.
Yes.
And there is incredible encouragement coming from this fantastic group of volunteer doctors and nurses.
I think when I started volunteering, I really assumed that it was going to be all people that were in a lower income bracket that could not afford health care. As health care's changed and our economics have changed, I actually have seen a different description of people who need to access health care. There are those who don't have the economic base to be able to afford any health care. I think there are what I call the working poor. We have a lot of good people here in our community who have jobs, but for whatever reason they are not able to get health care. So even though they're working and working hard people, they still can't afford the health care. Then I have also a third group of people, which I call the retired poor. We have a lot of retired people in this community who can't afford health care or don't qualify for certain programs. And so I think we see a good mix of people here. It's not just indigent people here at this clinic.
You can also find the overall commitment here to helping the patient client to live in an overall more healthy lifestyle. That's exactly the purpose of the Risk Busters program provided here.
It's basically taking a patient and assessing the risk that they have on themselves at that particular point in their lives. So if they come in and we check their blood pressure, we take their weight, we check their glucose. What am I missing? Checking out, how much they exercise, what type of diet they have, and by getting the answers from them, we assess it and we tell them how we can correct it and make them healthier, better.
You guys can have some of this. Thank you. I think everybody here is sincere. Nobody's here to do something else or to put it on their resume or to get extra points at school. I think people are here, they sincerely want to be here, and they sincerely want to help everybody here. And you can tell that when they come in and the patients hug us.
And the patients, just like Stella, need those hugs and reciprocate those hugs.
I lived in Houston, And then I decided to come back to Boerne, and I have a hard time finding a job because I don't have a vehicle. And then my daughter was coming here, and she says, "Well, Mom, and then I'm insulin dependent, and it's kind of hard to get insulin if you don't have a doctor and if you don't have insurance." So, I heard about this place, and I've been coming ever since. I just didn't, insurance-wise, I didn't have it. I didn't have a job, and I didn't have any money.
Where would you be medically without a place like this?
I really don't know. I don't know because, like I say, I can't afford, insulin and syringes, all of that. Insulin's expensive, and it's just money I don't have. I would probably have to be going to San Antonio to get this done. And like I said, I don't have a car, so there's really no way I could get to San Antonio. But I would be in trouble. I would be in trouble.
Ultimately, realistically, there's a chance you wouldn't even be around.
That's true. That's true.
If it weren't for this club.
Well, that's true. That's very true.
For the determination of one woman to make a difference, for the dozens of volunteers who make this happen for the residents of Boerne, Texas, Equitable Life and Casualty agent Carolyn Dutson chose the Hill Country Mission of Health as a 2008 Ambassador of Caring Award winner.
Today, what we'd like to do is to present the Hill Country Mission for Health Certificate of Merit Ambassador of Caring Award to Mission for Health. Thank you, Joyce, so much for all the wonderful work you guys do in the community.
Oh, thank you so much.
And what I'd also like to do is add a small token of our appreciation, a $2,000 check.
So, this is like a total shock. I had no idea that this was even in the consideration. It's wonderful for us. One of our goals this year was to increase our visibility in the community, and so I think this may help us a little bit.
The $2,000 will help buy strips for checking blood sugar levels for diabetics here, will help offset costs for cholesterol checks, and provide just a little relief in the fundraising efforts for Joyce and her volunteers at the Hill Country Mission of Health.
So a mobile clinic that began as the dream of one person now fulfills the dreams of thousands of others for quality local health care here in Boerne, Texas. When Profiles in Caring continues, we stay in Hill Country, Texas, outside of San Antonio, Boerne, Texas, with another Ambassador of Caring Award winner doing today what they do all year long to help their local community. Don't go away.